Welcome to Vitality Made Simple, the podcast that empowers you to feel better, look better, and to enjoy better relationships. It's all about relationships. I'm your host, Dr. Debbie Osment, and I sincerely thank you for joining me. It is a true honor today to have Dr. Thomas Lodi with us. Dr. Lodi is a pioneer in the world of integrative cancer therapy. He has fascinating stories. He has strategies for healing. He cares about people. He cares about his patients, and he doesn't care what anybody else thinks. And I so appreciate that about you, Dr. Lodi. You are committed to helping people heal. Dr. Lodi graduated from the University of Hawaii School of Medicine in 1985. But before attending medical school, he actually worked as a clinical psychologist. He's been trained in internal medicine and in urgent care. He's going to tell us what all he saw and what made him decide to start traveling around the world, searching for effective, less toxic ways to help people heal from all kinds of chronic diseases, but specifically cancer. His training is beyond impressive. I just want to hear all about your adventures. And Dr. Lodi, thank you so much for being available to talk to us today.
Well, you're welcome, and thank you for having me. I'm honored to be here.
You were a speaker at the American Academy of Ozone Therapy's national meeting earlier this month, and I literally couldn't write fast enough to get your wisdom, your sage advice. I was fascinated, Dr. Lodi, by your perspective on healing. It truly integrates mind, body, and spirit. You just have so much common sense, or really, I should say, you have so much uncommon sense in terms of being a medical doctor, and that's the reason I was so excited about talking to you. So tell us what led you into your current world of integrative cancer therapy, and tell our listeners what integrative oncology really means.
First of all, I never wanted to be a doctor. I had no desire to be a doctor. The only reason I went to medical school finally was because had been a psychologist. I'd spent the first part of my life actually reading scripture and uh, traveling around on spiritual journeys. But when I came back to the U.S., I went to graduate school in psychology and did my training and practice there. And I just kept finding that I didn't know enough. I kept not, because I didn't understand the body and the physiology, and I also didn't understand the effect of drugs that people may be taking, prescription or not. Because I didn't understand that, it was like looking at looking at a landscape with one eye. You don't get the full dimension of it, right? You need both eyes for the binocular vision. So I really couldn't see it all, and I didn't understand it all. So I went to medical school just so I could better understand what I was, each person. And there were some amazing situations that finally resulted in me saying, I can't do this anymore. I have to go to medical school. So I went to medical school, did my training, then I went to New York for residency. And after residency in internal medicine, I started oncology fellowship, but I couldn't do it after a few months. I saw that we were just killing people, so I left that. And then I worked about 10 years as an internal in intensive care units and cardiac care units, surgical intensive care units, and emergency rooms. So I did urgent care because we had an answer. We could fix it or we couldn't. Either way. And but the long-term management of people with chronic conditions in the hospitals is beyond absurd. It not only doesn't work, it's damaging and it kills people. And it starts out with the mind, and it's actually psychological battery. It's psychological terrorism. It's what they do, and that's how they get what they want, because they know that if they scare you to death, you'll agree to do anything. I'll get this cut off, sure. Cut this off, yeah, yeah. But because you're paralyzed, you're totally paralyzed, and they do that, and they call it the standard of care, and I call it the standard of scare, because it is. They scare people to death.
Oh, that is so great. It's so true. Fear, people will do the stupidest things in the world if they're scared. And that's the oldest tactic in the world. And, one thing you said in your lecture was that you want to help people understand that they should never accept a diagnosis. Uh, you know, the
Right,
medical establishment
right.
pins this, it's pinned the diagnosis on the donkey, is sometimes what I call it, um, because, you have to have this diagnosis. So explain your philosophy there, Dr. Lodi.
Sure. And then let me finish. So anyway, after I did that for 10 years, then I realized like it didn't work. So I went around the world. I went to Mexico. I went to Japan. I went to Europe. I went to throughout America and I just studied and apprenticed under people. Then I finally came back to New York in late 90s and started doing what I'm doing now, right? And then we moved to Arizona 2004 because New York, uh, uh, I kept having to go before the board to explain why I was giving vitamin C and other things. So
Mhm.
anyway, so I went to Arizona, which is a lot more free in that medically,
Mhm.
and so 2004. Yeah. So anyway, that's how I got to where I am. And integrative oncology, real quickly, is just when you use all disciplines, all medical, I mean not medical, all healing disciplines, and you bring them together and you use whichever is required at the moment. And in order to do that, you've got to understand both the allopathic side, you've got to have that training, you have to have that knowledge, you have to have that experience, but you also need to understand the other side, the holistic side. You need to understand, and the difference basically between allopathic and the traditional indigenous healing disciplines is that the allopath is going to fix you because something's wrong, whereas the indigenous, whether it's traditional Chinese, Ayurvedic, or any of the Native American or Native African, Native South American, European, all these indigenous therapies um, around the world, Australia, New Zealand, New Zealand's got, they're indigenous people. And so anyway, they all their healing disciplines are based on the understanding that there has been an imbalance. And because of this imbalance, there's an adaptive response that's required to maintain balance, to maintain homeostasis. So they just want to help correct that balance because they have respect for the intelligence, the divine intelligence that put this incredible earth suit together for us. It's God. So God, you know, and 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 you get that really clearly when you go into training and you become an allopath or an osteopath or a naturopath or even dental professional, doctor, you find out that there's no way you'll ever understand it. For example, oxygen's really good for you at 21%. At 100% oxygen, you wear a mask with 100% oxygen. Within a couple of weeks, you'll have emphysema. Okay, now also we know that glucose and glutamine feed cancer. But without them, but glucose also is necessary for the carbon background, for the carbon skeletons necessary for our cells to make fatty acids, to make cholesterol, to make all the things that we need to make, all the things we need to make. And we need glutamine for the same reason. Glutamine is not only a secondary fuel for cancer, but it's also the primary fuel for lymphocytes. It's also the primary fuel source for our enterocytes, our small intestines. So it can't heal without it. So it's not like, okay, well, I'll get rid of the glutamine. I'll get rid of the glucose. I'll do a ketogenic diet. All right, well then, if you do a ketogenic diet, the cancer is gonna say, okay, well, just eat glutamine now. But on the other hand, you have to understand, glutamine is a non-essential amino acid, meaning we can make it, and glucose we can make from protein. It's called gluconeogenesis. So I've had people on 41-day water fast, and we check their blood sugar every morning. And why is it on day 40 their blood sugar is normal? Now this
Really?
is water. So in other words, why? Because we're making it, right? We're making it. So that's what needs to be understood is that you can't say, okay, well, we'll just do this. Because if you consider the fact that we have 36 septillion chemical reactions going on every second, that's 21 zeros. Okay, and so perfectly that here I am. It's working. It works. My heart. Think about it. Your heart. If you sit on the couch and do nothing, your heart beats 100,000 times a day. doing nothing. Imagine if you get up and move around and it's going to do more. How about breathing, right? And anything, all the things that's happening in our bodies is so beyond complexity. So you can't figure it out. So we have to come to that conclusion that you can't. It's not possible. Not even a computer can figure it out. And so what you do is you regain a respect and an awe for God and all that was produced, created. Now, understanding that, and so and that's a true awe. So I really would like everyone to reconsider their current use of the word awesome.
Oh, this is
Okay,
going to be good.
we have degraded. We did have degraded the English language to such an extent, and if you want to get an understanding clearly of how much, pick up a novel written in 1915 or 1890 in American English. I'm not talking about British English because they've always been way ahead of us with English, but American English. Read it, or read a medical journal, or read anything from 1915, 1910, 1905, and you're going to see that their working vocabulary, their use of syntax, their use of grammar, way beyond us. Look at a movie from the 1930s and just look at their normal conversation, their grammar, their working vocabulary. Now we have destroyed. Our language is limping, and now people are getting to the point where they won't even spell. They're putting the number for you. For you. I don't even accept that from a non-native English speaker. I'm going to teach them how to write FORNYOU. I mean, it's not that much more. It's 3 more letters to do both. It's not a big deal. Why are we doing it? In fact, when I read this kind of script, someone sends it to me, I have to figure out now, how would I say something wrong so that it could come up like this? What word are they trying to convey with this? So it's really ridiculous. So, but anyway, that's where our English language has come to. And the word awesome. So I was buying a pretzel for my son one day when he was young at the mall. I said, okay, we'll have 2 pretzels. And she said, awesome. Well, if that's awesome, then what is a sunset? Right? What is it? I have to have a new word, because that, to me, a sunset is awesome. The fact that my body works is awesome. So anyway, so bringing it back into harmony, if you can, bringing it back into balance, restoring balance, and then it will do what it was designed to do. Our bodies were hardwired to regenerate, rejuvenate, and procreate. Regenerate, rejuvenate, and procreate. That's what they do. You pick an apple from the tree, next year there's 3 in that spot. You pull your weeds from the backyard, you turn around, they're back. That's the nature of nature, okay? And to have the audacity and the arrogance and the ignorance to think you can stick your finger in the middle of this and block this one thing and you're going to change the course of the river. No way. You put a boulder in the river and it'll go around it. So that's not how you deal with it. You don't try to block the river, you jump on it and ride it, because that river is life from the heart of God. So, and it's all based on science. And I want to tell you something about science that's very, and a lot of people haven't thought of it this way, but science has the parents, the mother of science is ignorance, and the father of science is atheism. Okay, now I'll tell you what I mean. So science is based on ignorance and atheism. So what I mean is that in science, they are saying they're starting all over. They're rejecting all the wisdom of the past. And they're saying, we're going to start all over. We know nothing. And they're going to try to prove it. And that's what it is. So now they do a study with this, and then okay, now this is true. This is true. They got to prove that walking upstairs makes you tired. Right? Anyway, so, and for example, I was going to say with food, when you cook food above a certain temperature, you heat it above a certain temperature, and you've gotten rid of all the water, sugars combine with amino acids to produce Maillard chemicals. And that's what makes food smell good, and that's what makes it taste good. And Maillard chemicals do not naturally. Okay, we don't in our biosphere unless there's lightning or a fire or a storm or a fire, forest fire. So anyway, one of the chemicals is called acrylamide, and they found out that acrylamide is carcinogenic to every species they've tested, from reptiles, amphibians, and all the mammals they tested. Acrylamide is a carcinogen. So what's their conclusion about humans? It might be.
Oh, if it is with every other species, it might be with humans, you're saying.
So it's based on ignorance. We know nothing, and we're going to learn everything, and we're rejecting all the wisdom of the ages, and of course, even including the wisdom of the Bible, Solomon, Jesus. It's all, but not only that, we knew the world was round back then, and then okay, whatever. So we reject all that. We started over, and then and so it's based on ignorance. So that's the point. The point is that science is derived out of ignorance. Now, secondly, science says that there's no intelligence in the universe and that everything occurs randomly. Right? And that suddenly there was nothing. Now, when you say there's nothing, that means there's not even space. Right? If there's nothing, okay. And then out of this nothing, because if there was something there before the Big Bang, if there was something there before, then how did it get there? Would be the question, right? So there had to have been nothing, and that nothing included no space, right? So no, and it's unfathomable. Anyway, so there was nothing there, and then suddenly it exploded. Okay, it exploded with a tremendous force from not from anywhere, and then it just flew and randomly assembled itself into the most precise universe you can imagine. And I'm going to tell you what I mean. When I look at the Big Dipper, it's the same Big Dipper that Julius Caesar saw.
Yeah.
The same Big Dipper that the Pharaoh saw. Okay, now consider the fact that we're tilted at 23.5 degrees on the Earth, and we're rotating at a little over 1,000 miles an hour, and we're flying around the sun at over 60,000 miles an hour, and the sun, the moon, and the Earth are flying through the Milky Way galaxy at over 600,000 miles an hour. All of that is happening, and yet the Big Dipper shows up, and all this other stuff shows up precisely. How precisely? You can set your clock to it. If you look on a chart and it says on September 3rd, 2723, the sun's going to rise at 6:01 a.m., it will rise at 6:01 a.m. So that's precision, that's order. And order comes from intelligence. Chaos comes from ignorance. And there is no chaos in the universe. The only place that there's chaos in the universe is in the mind of humans. Otherwise, there's no chaos. Everything's ordered. And if you don't understand how much, look in a microscope, look at a cell and see how that's working. And then take another look when you're done with that with a telescope and look at the stars and look at the order there and all that. And understand that all of these phenomenon that we witness are obeying the laws of nature. Right? If I drop a stone, or if a dog falls out, or a human falls out of a window, you drop a stone from the window, it doesn't matter, or an elephant comes from the window, they will both land at the same time. They will hit it because they will travel at 32 feet per second squared, period. So these are the laws of nature, okay? And yeah, so therefore they're the laws of God.
Oh, I totally agree. And I so respected that at the conference, you talked about that. You said nature is not random, and it does not make sense that all this beauty happened randomly. And that is hope for any illness because our bodies
Right.
aren't intelligently designed.
Exactly. They're intelligently designed and they're hardwired to heal. That's
Right.
what they do. If you leave them alone. If you get in the way, you're gonna prevent healing.
Well, and I appreciate that you talk about there's really no such thing as a disease. You're a human being with imbalances the imbalances are manifesting in some specific area. Embellish this, Dr. Lodi.
Sure, and that goes back to your other question about diagnoses. Diagnosis, dia means separate, and gnosis, gnosis, gnosis means to know. Okay, because you remember the Gnostics and all that. Anyway, it's knowledge, to know. So how do you separate and know something? You name it. You give it a name, and now it exists. And I want to tell you how important names are and how important words are. Because what's the first thing that we noticed that God did? He said, "Let there be light." Said light. And in other words, words are, in the beginning was the Word was with God, and the Word was God, right? So words, we have to understand the power of words, okay? And when you, if you understand, if you look up sorcery and you understand that the way they work, they have to have a particular environment, like they might have an upside down cross, or they might have the pentagram upside down, or they might have, I don't know, different talisman around or whatever they have, and they have all this, and then they wear a certain garb and a hat, and then they pronounce, they say things to cast the spell. This is witchcraft. Okay, now I want you to go into the modern day house of horrors called hospitals, and you walk in there, and you're going to walk up, and it's, all this is and a loudspeaker, Dr. Downer, please come to the all this stuff going on, so that you move, you're in the environment. Now you walk up to the doors open, and there, sitting at the desk, is this person with a white cape, white coat, white cape, whatever, and on the back of the wall are all these certificates. Okay, they've set the scene, and now you sit down with this person, and they're looking over the charts. Then they take down their glasses. They say, "You are ductal carcinoma inside you. You are congestive heart failure. You are whatever they say, it's now in your heart." And I hear people, if you listen to people talk, they'll go, "Well, before I was diagnosed, after my diagnosis," they talk like that, because basically what they've done is they have stopped you from being the incredible human process that you are. We're not, in other words, consider the fact that we make 37 million new cells per second. Okay, so what I was last week is certainly not what I am this week, right? By hundreds of billions of cells already, I'm not the same. So if you put a name on it, and I'm stuck there. Anyway, so what I'm saying is they enslave you. They give you this name, and you walk around. And I hear people say, "I'm an 18 years cancer survivor." What is that? Is that you? That's what you are. Listen, and when they make movies, they're making a movie, and they take a snapshot on the set in a certain situation, right? And they call them stills. And those stills are used later for advertisements, for marketing, right? A picture of this guy with his arm around here or whatever, like this. Those stills. Well, do you think if I looked at a still, I could tell you what the movie's about? No.
Wow, that is an incredible analogy. I love it.
Okay, so that's what that's what they do, and we become that still.
You're
And they
stuck.
named it. And so they named it with their nomenclature.
Mm-hmm.
And their nomenclature is, why do they use their nomenclature? because it fits directly on their sales algorithm. They have a sales algorithm to sell services, products and services, right? We're gonna do a CAT scan, and then we're gonna, you need this, whatever it is, it's the sales algorithm. That's the only reason for it. That's why if you've ever seen a especially in cancer, the doctors, you got to get a biopsy. I don't want a biopsy. The reason they want to do a biopsy is because they want a histological description. Ductal carcinoma in situ. What does that mean? Oh, it's in the duct. Okay. It's cancer, and it's from the epidermal, so it's called carcinoma. Okay. And invasive means it went through the wall of the duct. Okay. That's all it says. That's a diagnosis. Wait a minute. It didn't tell me the two most important things I need to know. How did I get this, and how do I get rid of it? And if it doesn't give you that information, of what value is it? It's of no value except to put in the sales algorithm to get our sell our sales, our services and products. I mean, that might sound like I'm like being bizarre or being exaggerating, but it's exactly the truth. It's
No,
exactly the truth.
I agree, Dr. Lodi, because so often then people are just stuck and they don't have any options. They just have to wait for whatever that is, their doctor said. They're no longer in charge of their own body. Patient autonomy is out the window. And they're labeled. Your analogy of the movie is perfect.
Right. Yeah. And that's, so that's the tragedy of it. So when you get diagnosed, you've been cursed. Just change the word. Don't call it diagnosis now. I need to, and if you're a doctor and you're going to say, okay, I need to go curse this patient. I need to go curse this person. That's what you do. You're putting a curse on them, a spell. And doctors even go so far as to tell the patients when they're going to die, which is, I can't tell you how many couples have been sat before me. One had cancer, the other one didn't, and the other one died first from a heart attack or an automobile accident or everything. So the truth is that none of us have a contract for tomorrow. Okay, we're here today by the grace of God. We'll be here tomorrow by the grace of God.
Thank you so much.
Period.
I so appreciate that. Well, I love that you said you don't even like the word cancer because it has such a fear mongering definition in our world. So you like to say RECNAC, wasn't that like cancer backwards or something? To redefine.
Yeah. Well, because there's been hundreds of billions of dollars spent to pack this word such that it has an immediately when you hear it, it goes straight to your limbic system and you turns on you all of these emotions of fear. Because basically what they're telling you is that you're going to die. They've just taken away your future. You have no future. So whatever agenda you had, whatever plans you had are no longer relevant, right? And so
all your money, everything.
Oh yeah, and money, and so that's what they've done. They've taken away that, and that's what the word means. It's a Rockefeller word. Period. All of this whole medical establishment is Rockefeller, based on Rockefeller's paradigm.
Well, you were saying that when somebody, we kind of talked about how you like to say RECNAC, you like to spell it backwards because the word has such a connotation. And I so appreciate it. It really does seem to steal people's future. Suddenly they're frozen in time. They are fearful. And of course, that's hurting their immunity. I think that's where maybe you were headed.
Yeah, you're absolutely, thank you. And that's what it is. So when you're in that place and they've in fact, fear. We know that fear. When we know that the immune system is the shadow of the mind, right? Mm-hmm. So when you're really happy and optimistic, you're hugging someone, or you just your long lost somebody comes through the door and you're hugging them. If I were to check your blood, your natural killer cells would be high, your T cells would all be activated. You'd be like that. On the other hand, if you just got some really bad news in the mail, or you're afraid or angry or sad or regretful or any of those things, it suppresses the immune system. So we know that, right? So anyway, so that's what they've done with the word cancer. So what it really is on a biological level is it's chronically fermenting cells. So all the people I work with, my students, not my I don't call them patients, I like to call them students, is that we call them CFCs, chronically fermenting cells. Okay, because that's what they are. And the other, you can even call them RECNAC, which is cancer backwards. But whatever you use, it doesn't have that emotional impact. It doesn't steal away your heart and soul. So we got to change the name of it, okay? Because they love that word. They love that name. Okay, that's why if you don't want to go to a cancer center. You don't want to, you just get away from that word. So it's their word, it's a Rockefeller word, and it's a diagnosis and all that sort of thing. So you just don't want to do it.
Well, I think that's very biblical, really, when you think about, as a man thinketh in his heart, so is he. I think that's in Proverbs with King Solomon. And, so much has been studied just about the power of the mind. I mean, even, I always like to say, Dr. Lodi, God said it first, and then we figure out from other methods that, oh, wow, that was true. But, people move in the direction they're thinking. If it's vitality and health, they move that direction. If it's fear and, oh, I'm going to die, then I've seen that among my clinical patients for 40 years. And it's never been more pronounced than in our world of cancer.
Yeah, yeah, and you can even look at other conditions, like someone goes to the doctor and finds out they have rheumatoid arthritis. So they put you in this. That's you now. You're rheumatoid arthritis. Now, then they give you stuff on it, and you read about it. And what they always tell you, in almost every condition, if every condition, this is not curable.
Right.
This is not curable. So they take that away. Get rid of any hope you have of being restored to health. Forget it. What? Well, it's not curable because there's nothing wrong. My body, if it's inflamed, that's what it's doing it for a reason. We have to find the reason and eliminate the reason. And if we understand that, when we talk about disease, right, we talk about diseases as if they are these entities that exist outside of us and somehow get into us, and we have to get rid of them. So it's kind of it was borrowed. The disease model was borrowed from the germ theory, and the germ theory we know is wrong because we know Louis Pasteur was a fraud, so anyway, so the diseases are out there. So you have diabetes. Oh, I have it. Okay, where is it? Is it like in my elbow or my pancreas? Where is the diabetes? Okay, there's no it. There's no it. If I'm eating pasta, bread, rice, and potatoes, and I have a lot of glucose in my interstitial fluid, the divine wisdom of my body will make it such that my cells become insulin resistant because the wisdom knows that the glucose will kill it. So it's a homeostatic corrective response, an adaptive response to maintain functional integrity. So that's what it does. The body is doing that. Okay, so I need medicine, I need drugs. I need to stop eating the pasta, bread, rice, and potato, and then that adaptive response will no longer be necessary. Now, this is true of high blood pressure, it's true of arthritis, it's true of cancer, it's true of all these different things. In fact, they are all different manifestations of the same underlying process called toxemia, toxic accumulation, right? And that's it. And that's it. That's why people go on detoxes and, oh, my arthritis cleared up. I don't have any chest pain anymore. My blood pressure is normal. Oh, my blood sugar is normal. Oh, how is that? Because there's one underlying process. That's it. That is disturbing the balance. And that's what and so we have to regain a respect and an awe for nature and realize there are no these entities that are going to get into us, just like, otherwise then we have to consider doctors to be like exorcists or magic. They got the magic potion.
But Dr. Lodi,
It's slowly.
but in reading up on you, I mean, what's one thing that's so impressive about you is that you know, you do integrative methods. So, sometimes it's different for everybody. You see each person as a unique individual, an N of one. And so, I mean, from what I've read, you always try to everything to get the body back in balance, but at times surgery is required. At times you might use chemo. Is that correct in your current practice?
So it's integrative. So we use whatever's necessary. So yeah, for example, if I had a man not long ago with a tumor in his colon, and he wasn't his bowel. We couldn't, we did colon hydrotherapy, and we weren't getting much out, and all that, and the pain was getting worse and worse, and he was finally in. I would say he was 15 out of 10 pain. It was like beyond excruciating, and we had to get him to the hospital, and they went in, did the surgery, and it was like 100% blocked. There's no other way you can deal with that situation.
Right.
And you have someone with a glioblastoma that's growing rapidly in the brain. You can't wait around and do vitamin C and herbs. It's not going to work. You have to do radiotherapy, radiation therapy to the brain, to the spine. You got something on the spine, and it's about to encroach on the spinal canal. You've got to do radiation real quickly. I had a woman the other day who had a tumor on her femur. I talked to her on the phone by Zoom as an initial consult, and the tumor had actually grew so fast it fractured and broke her femur, right? The big bone in your leg, right? So for those out there that don't know what a femur is, and that's had we gotten her like a week before, we would have said, okay, let's do some radiation to do that. So yes. And chemo, we do low. If we see that the cancer is about to encroach upon a vital function, or it's excruciatingly painful, or whatever, then we will do insulin potentiated low dose chemo. We use insulin to potentiate it because it targets it, right? And that way we'll do the chemo. So it's not that we don't do these things; it's just that we do many other things, and we use them when appropriate and where appropriate. That's an integrative approach.
Yes, that is absolutely incredible. I test like the oral microbe. I'm sorry, I test the oral microbiome and often find high levels of Fusobacterium nucleatum, which is a bacteria that travels to the gut and is involved in colorectal cancer. So then when I, test the, do a GI map, test the gut microbiome, often I find that actually 100% of the time, Dr. Lodi, I find that Fusobacterium is high in the gut if they have gut problems. So we have to use antibiotics. The point is, I don't like to use antibiotics, but in that case, we got to use antibiotics. And that's the best integrative approach. So I really did appreciate that you employ whatever is necessary for that individual. Tell us about what life is like at your Oasis of healing, your centers where you help people.
Sure. An Oasis of Healing in Arizona. We've opened, we're about 18 years now. We've been there, in Arizona. And we do everything. I just don't find this anywhere. I've been around the world, and I don't find any place that does it all. So I've opened up a couple other centers in Thailand and one in Kuala Lumpur. But when I leave them, they go back to being allopathetic, shall I say?
Oh, that's hilarious. So you're saying when
they go.
I'm sorry, when you go home from Arizona, they go back? When you go back to Thailand?
Right. So I'm right now in the process of building a new center there. So we're gonna have two new centers, but right now I don't, because the places that I worked with previously, I stopped working with like 4 or 5 years ago, because they don't get it. They don't get it. So, and it's just, same thing anywhere. But at Oasis in Arizona, it's always been, and it's maintained that. So when you come in, you're basically a student, and you're going to learn how to You're going to learn, there's what we call the School of Life, where we teach you about your body and what it is and what it needs to, and we teach you what food is and what you need, how to prepare it, how to choose it, how to prepare it, to eat it. So the point is this: we are hybrid epigenetic mutants, right? We're no longer earthlings. Well, however, we are, because once the breath of God leaves us, our bodies turn back to earth. So we are truly earthlings, right? Except that here's the problem: we don't accept that. We think we're American, or we're German, or we're Thai, or we're Chinese. We say, no, I'm not, I'm that, right? And all of our behaviors are cultural instead of instinctive. Why is that not a good thing? Because instinct is the divine web by which all creatures are connected to God, right? It's how baby bird joins the flock and turns perfectly without going to aviation academy, without rehearsals, right? It's how that new spider spins a perfect web. This is instinct. And what do we tell our kids when they're born? No, stop, don't. No, stop, don't. No, stop, don't. Your instincts are unacceptable. The sins of the fathers are visited upon the sons. The sins of the parents are visited upon the children. It's another way of looking at it, okay? Because we tell them no, stop, don't. And then the minute they open their mouth, we start stuffing them with non-food. Now, what is the center of every culture? What is the centerpiece of every culture? Cuisine. Right? Are you going to go to Italy and not eat pasta? Nah. Why go to Italy? Are you going to go to China and not have Chinese food? No. So we equate cuisine with the place. So I want to tell you something. It's not genetics either. There's no gene for cancer. Do you think God would be so cruel as to give us a gene for cancer? Or if you were scientifically motivated, or you believe in the science thing, then evolution, remember, what's the hallmark of evolution? Survival of the fittest, natural selection. So if we did have a cancer gene, it would have been selected out. It would have been gone by now. We wouldn't still have a cancer gene, but we do. So I mean, if you think we have genes, so we don't have genes for cancer, right? Cancer is not genetic, and heart disease is not genetic. Diabetes is not genetic. None of these things are genetic. The only things that are genetic are Down syndromes, Hunter's syndrome. There are certain, less than 5% of humans have actual genetic defects. Then 95%, then you can't blame your genes or anything. You can't, they can't be, a thing. So anyway, it's not genetic. And since 1 out of 2 men and 1 out of 3 women in America will get cancer in their lifetime, and if it were genetic, that would mean that we should all have at least one grandparent who had cancer, right?
Wow, that's right. Just mathematically, right?
Right. Otherwise, so then it's not genetic. And and why when Rockefeller started the what later became known as American Cancer Society, why like in 1907, 1908, 1909, 0.07% of the population died from cancer. 0.07%. Okay, today 40% of the population dies from cancer. Mm-hmm. So why, when there was 0.07%, did he make why did he devote a whole discipline to something that was of minor significance? No significance. You know what I mean? So, well, I guess he knew something.
Wow.
Anyway,
so interesting. Well, I'd love to hear some of your success stories. I've heard you talk about a few of those on your Instagram. For my listeners, Dr. Lodi has a fantastic Instagram, and just tell us some, miracle stories that you've seen, Dr. Lodi.
There's many, but one that comes to mind is a woman who stage 4 cancer, told she just came from breast cancer, and it was in her lungs and her bones and I think liver. She got she was on a gurney. They brought her into our clinic on a gurney, and she had just come from her oncologist, who told her she had 3 weeks to live. Nice thing to say. And Anyway, when I walked up to the gurney, she grabbed my arm and she said, "Thank God. Now I know I'm going to make it." Okay, 6 weeks later, she was jogging to the clinic and her husband would follow her to make sure she was okay. And 8 years later, I get a postcard from Paris. Okay,
Wow.
so that wasn't me, that was her. Just like the woman that touched Jesus's coat. He turned to her and he said, "It wasn't me, but it was your faith that healed you." So when she said, "I know I'm good," now, thank God, now I know I'm going to make it. That was it. So when you know what's going to happen before it happens, it's called faith. Okay, you don't believe it. You don't think that it's possible. You know it. Just like when you cut your finger peeling a avocado or whatever, you don't believe it's going to heal. You know it's going to heal. You rinse it off, put a Band-Aid on it, done. When you know this is going to heal, it will. That's the power of faith. It's the power of knowing. So anyway, there's that. And then I had another woman, 2001, way back, who, same thing. She didn't even want an IV. She just wanted to do what I had talked to her about. And she had cancer all over. She was told she had 3 months to live. She changed, she did a cleanse, a fast, started eating real food, did all the things. We talked about prayer and meditation. She did colon therapy. She did all that stuff. I met her in June of 2001. And then in December, I saw her the last time I saw her, and she was like, just everything was, because she couldn't move initially. She couldn't move because she had so many lymph nodes from the cancer, so many lymph nodes in her right that she couldn't lift. The last December, she was like this. Then in January, she had a fatal automobile accident. And when they did an autopsy, there was no cancer.
Wow. No, I believe it 100%. That
So, and that didn't even involve me. So what I'm trying to say is that the most important thing is the mind. And as I said before, the immune system is the shadow of the mind, right? And here's the problem with the mind. It's not thinking is not voluntary. It's an involuntary process, like your heart beating. Okay, you don't decide to think. Thinking is a happening. And 90% of our thoughts are subconscious, and 80% of our thoughts are negative.
Really? 80%?
80%, according to psychological literature, because we grow up with no stop, don't, no stop, don't, no stop. You're going to hurt yourself. You're going to fall. Don't do that. Don't remember what happened last time. What is your friends going to think? What is the teacher going to think? What are your neighbors going to stop, 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 stop. So that's what we learned from the time. So 80% is negative, and especially over the last 3 years since the great hoax. So we've had all this negativity. So now we're very, very negative, and that means as long as you're thinking, you've got your foot on the brakes of the immune system. If you're thinking. Therefore, you have to learn to not think. And not think is, the way I say it is, take 2 minutes. I want you to pray 5 times a day. Just check in with God, say thank you for another day. And then I want you to listen for his answer instead of rudely getting up and walking away. So sit back and listen for 2 minutes. And where do you listen for God? In your breath. God is your breath. He breathed into Adam's nostril in Genesis 2, and Adam had life. And when we finally exhale, it's over. So it's the holy breath of God that animates the flesh. So you sit back and for 2 minutes with 100% of your attention, listen. You won't get more than 5 seconds, and then you'll be somewhere else. Then as soon as you realize it, you bring your mind back. Anyway, you practice doing this for 2 minutes, 5 times a day, and you will eventually develop a mind muscle that would allow you to turn off, tone down, do that, which means every degree to which you tone down, your immune system goes up. It's called psychoneuroimmunology.
Yeah.
So very, very important.
Oh, I totally agree. And I love the holy breath of God is what animates the flesh. The holy breath of God animates the flesh. Boy, that is incredibly touching and profound. Oh, thank you. That's great. Well, Dr. Lodi, another thing I've heard you talk about is sleep. And I so appreciate your down to earth suggestions. Give those to us and tell our listeners about doing an emotional enema every night.
Yeah. It's a mind enema. And so what we do is you just basically, you're supposed, we were designed physiologically to go to sleep at around 8. about an hour and a half after sunset. And humans are from the equatorial zones where there are 12-hour days and 12-hour nights. So sunset is always by 6:30 latest, which means by 8 p.m. If we were 5,000 years ago, you'd be going to bed at 8 p.m. because there was no clock in those days. But around 8, about an hour afterwards, you would be tired and go to sleep. Wake up naturally at 4 a.m. And when you do that, you're able to get 3 of your 90-minute sleep cycles in before 1 a.m., which around 1 a.m. is the biological reset point. It's where your new day starts. Okay? Your cortisol starts to be produced, your prolactin starts. So all these things start to happen. And anyway, if you had 3 90-minute sleep cycles, then because before that set point, 80-90% of the sleep cycle is restorative sleep, and only 10 to 20% is dream sleep, which is sleep, rapid eye movement. So after that set point, after 1 a.m., it's the opposite. Most is dream sleep and just a little bit of restorative. So going to bed at 11 p.m., waking up at 7 a.m., you still didn't restore everything. So when you go to your new biological day and you start to produce cortisol and all that, your adrenal glands haven't been restored. Nothing's been restored. So you're not going to get the optimal functioning. And if you do this for a decade, 2 decades, 3 decades, like we all do, you go to sleep late, then you are ensuring that you're going to age quickly and die soon. Okay, that's what he's doing. So anyway, so if you're having trouble sleeping, you need to sit down and write everything, turn off all electronics, get a pad and pen, and write down everything you did today, everything you need that you didn't get done, everything you need to accomplish tomorrow, everything you need to accomplish the next day and the end of the week, and kind of just put it all, figure out what it is you need to do and you didn't do, and things you can cross off your list and all that stuff. And when you're done with that, you will have emptied your mind. Now, when you go to sleep and the room is cool, you wear an eye mask, you put in earplugs, and you get into silent, and you listen to your breathing real quietly, and pretty soon it's morning. And you've got to take melatonin because we all have calcified pineal glands from the fluoride that we're getting inadvertently, and other things.
How much melatonin? Excuse me, Dr. Lodi. How much
Well,
melatonin do you recommend?
a very minimum of 20 milligrams, but it depends. If you, some people can't take it because it gives them paradoxical effect of keeping them awake. So so you have to see how much you can take. You start with 3, maybe go up to 5, all that. But if you have a chronic condition, you want to get up to at least 20, right? And I, for example, take about 120 every night.
Well, Dr. Lodi, thank you for joining us. How can people find you? Of course, on your Instagram, and then an Oasis of Healing. Any other places that people can stay connected to you?
Yeah, well, it's Facebook and Instagram and TikTok, and they're all Dr. Thomas Lodi, Dr. Thomas Lodi, and that's how you find it. And then I have a live event every Sunday at 7 p.m. Eastern, and question and answers, and yeah, and then so I have on oasisofhealing.com, which is our clinic in Arizona. And then I have a separate website for me. It's called drlodi.com. Yeah, drlodi.com, and that's just me. And either of those you can go to, and that's it. And then, but I'm available for consultations personally. You can find that on drlodi.com. You can book one, and so, and if anyone has cancer, that would be, the thing to do. Either call Oasis or contact me, either way, and then I'll have a consultation with you, come up with a plan after looking at everything, and then we can fit you in somewhere. And even if a lot of times people will need to stay home. I mean, they can't afford to come, or they can't afford the time to come, or they have too many obligations, like young children or whatever. There's a lot of times. So I will write out a plan and then collaborate with your doctor. If we can find a local doctor and we can collaborate together. And the only other things I want you to do is you need to have a biological dental evaluation.
Absolutely.
I don't know how the mouth ever left the body, but it did, and we wound up with 2 professions.
Well, I have a TED Talk, Dr. Lodi, called The Forgotten Orifice. That talks about that. Yeah, the forgotten orifice. Exactly. It really is. It's disconnected.
It's bizarre.
Yeah.
It's
Well,
bizarre. I mean, the set, if you look at embryology, we form from a tube that's called the gastrointestinal tube. You got arms and legs and everything come out of it. Now, that has to do with bringing in food, from the mouth to the anus. Okay. Now, the first part of eating is teeth
yeah.
and
Yeah.
tongue. What? And now we're not going to talk about it. Anyway,
Yeah.
so we do that. We have to get a biological evaluation, a biological dental evaluation, and then you have a doctor, I can work with them, and I'm happy to do that. I have a course on my at drlodi.com that we have a course called Stop Making Cancer. It's like an 8-hour video course where it's me and 3 other people that it's kind of learning how to stop making cancer. And who needs to stop making cancer? Every one of us. We
Everybody.
have nanograms, micrograms.
Everybody. Yeah. Oh, I can't wait to get on there. That's fantastic. Well, thank you. It's just been a joy to talk to you. I so appreciate your time. And listeners, thank you for joining me for Vitality Made Simple. Because of your sharing this podcast, we're now in 91 countries. We're in 1,950 cities. And that's because of you. And please subscribe, please share. This information can help so many people. And blessings until next time.